What is parent-child interaction therapy? I hope you're having a good day. My name is Chad Severs, and I'm your webinar moderator today. I'll let our speaker, Joy Pemberton, introduce herself here in just a second. I'm going to go over a few housekeeping slides first. Okay. We encourage you to ask questions during the presentation, and if you'd like to do so, just be sure to use the question feature, which is on the right side of your screen. If you're interested in earning 1 CEU, just be sure to stick around to the very end. There's a code given, and you'll need to email me that, and there's more instructions at the very end of this webinar. If you're watching in a group, I'll just need to know who the person was that logged into the webinar. Just as a reminder, this webinar is being recorded. We will upload the presentation to our website. And be sure to like us on Facebook. Check us out there. We post information and upcoming training such as these webinars. And so yeah, just be sure to check us out on Facebook. So I'm going to go ahead and turn the presentation over to Joy.
Okay. All right. Chad, can you hear me?
I can hear you, Joy.
Okay, sorry. Not sure. Okay, there it goes. Okay. All right, I'm glad that you're all here and that you're interested in hearing about PCIT. Like Chad said, my name is Joy Pemberton. I work for UAMS. I'm at the Child Study Center in Little Rock, and I'm a psychologist, and I've been doing PCIT actually since 2002, which is a lot of years, but I'll let you do the math. At this point, besides being a certified therapist, I am a certified level 1 trainer, but now also a certified level 2 trainer, which I'll explain what that is more later. It's a nice advantage to have in Arkansas, so that's a good thing. What we'll be talking about is I'm going to cover the sort of basic description of what PCIT is and its background, and then I'll get into a little bit about why PCIT is helpful for trauma. And then I'll go through more details about the PCIT process, and finally talk about referral and training options for those of you who have people who need PCIT on your caseload or are interested in getting training for PCIT. And like Chad said, please don't hesitate to ask questions as we go. I'd rather get them answered as we go as opposed to waiting, since they'll probably be more relevant that way. Okay. So PCIT was originally developed by a psychologist named Sheila Iberg in the very late 60s, early 70s. So it's actually been around for a while now. She developed originally specifically for disruptive behavior in little bitty kids. It was initially thought of as sort of like that 3 to 5 age range, which is actually fairly limited. It is, since then, it's had a lot of research that's gone into it. It's officially considered an evidence-based treatment, and it's been shown repeatedly in a lot of studies to reduce child behavior problems and to strengthen the parent-child attachment. Besides being evidence-based for disruptive behavior, it's been adapted for a lot of different problems. There's studies underway right now that are looking at it for various things, such including like child depression, separation anxiety, and sort of a number of applications that it's so far looking promising for a lot of things. I think that it needs adaptations or extra components sometimes. It's also been used, it seems to be pretty robust to sort of cultural differences and that kind of thing. There's actually a list on the PCIT website of all of the different countries that have some type of trainer there. That's a longish list. I used to actually list the number of countries or different regions or cultures that it had been adapted to, but it's too long now. I know that it's in Japan, the Netherlands, Norway, Australia, Hong Kong, I think. I've actually lost track. I would have to go look at the list myself. The population for PCIT is now, I mentioned earlier a second ago that it was sort of originally thought of as a pretty narrow age range, of that sort of 3 to 5 age range. It's generally considered appropriate for kids ages 2 to 7 without modifications at this point. So if you've got a 7-year-old, you should generally be cautious, because if they're getting older, it's not just that PCIT may not be appropriate, it's also that you've got other options. There's treatments that are out there for kids who sort of got that longer attention span that kids naturally get as they get older. So you've got more options once the kid hits that sort of 7, 8-year-old age range, even some advanced 6-year-olds. One thing with PCIT is you have to have a parent or some kind of caregiver who comes to the sessions. This is not in any way a child-only treatment. It's very strictly based on the parent-child relationship. The parent has to preferably live with the kid. If they don't live with the kid, like if there's some sort of like a custody thing going on, they need to have in-person contact with the kid at least 3 times a week. You can use PCIT if you've got sort of the disruptive behavior issues. This is the classic PCIT population, kids with behavior problems. So that's the ones who are acting out, who are throwing tantrums in Walmart. You can't take them anywhere because they'll act up and you'll be embarrassed, or maybe they're aggressive, they're cussing out their parents, they're hitting their teachers. So those behavior problems that are really disruptive and really kind of get a lot of attention. It's also appropriate for families where physical abuse has happened. You can do PCIT with physical abuse perpetrators if they are moving towards reunification or something like that. We don't do PCIT with sexual abuse perpetrators. That is generally a different thing. The whole point of PCIT is helping kids be more compliant. We don't want to give sexual abuse perpetrators more compliant victims. So PCIT is generally not done with a sexual abuse perpetrator. It can be done with kids who have been sexually abused. That does not, because frequently kids who have been sexually abused have behavior problems. It's just with the non-offending caregiver in that case. Okay. For PCIT, it was not originally developed to be a trauma treatment, but as we've certainly noticed over the years with ARBEST, and I'm sure many of you have noticed also, kids who have experienced abuse frequently have behavior problems, and they may end up getting referred for that even when the abuse is not a central issue. Back in the early 2000s, some of the PCIT research groups started looking specifically at, can we help families who have had a physical abuse happen? Can we help them basically improve their parenting? And the answer was yes. Spoilers, yes. Parents who, in this particular study that was done in the early 2000s, parents were court ordered for treatment, and they had actually, the parents were the physical abuse perpetrators. And what they found was that when these families got PCIT, as opposed to sort of the treatment as usual, like parenting classes or whatever was available through their local version of DCFS, you had significantly less re-reports later. They followed them up for some years. And PCIT, the families who got PCIT were significantly less likely to get reported again for child abuse later. PCIT makes a lot of sense for decreasing physical abuse. The whole point of PCIT, not the whole point, but a big, huge point of PCIT is that it helps the parent establish a firm, warm, supportive relationship with the child. So when that is in place, the parent is less likely to resort to abusive behavior anyway. It also teaches the parent appropriate and consistent discipline. In many cases, physical abuse is basically physical discipline gone wrong. PCIT teaches parents how to discipline appropriately. So if you're talking about a parent who became abusive because they just don't have good parenting skills, then PCIT is an ideal treatment to help them with that. In addition, PCIT you see effects on the kids who have had trauma. So I was talking about basically the effects on the parent. The parent's less likely to abuse their child again. They have effective discipline skills now. They have a stronger bond with their child. It also actually helps with the kid trauma symptoms. When kids, as I said a few seconds ago, when kids experience trauma, behavior problems are pretty common in kids who have had trauma. Some kind of attachment disruption between the parent and the kid, whether it's because the parent was abusive or because they got removed from the parent's custody, or just because the attachment got kind of screwed up because, after the abuse or after the trauma, it doesn't even have to be abuse. Those are very typical things, and those are exactly what PCIT addresses. In general, if you have a kid who has had trauma, one of the best predictors of kids recovering from trauma is having some kind of supportive attachment relationship with a supportive caregiver. Stable relationship with a supportive caregiver, that's one of the good predictors of resilience that has been found. PCIT does exactly that. It addresses the attachment, it addresses the behavior. So if you can take a kid who's too young to verbally process their trauma, maybe a 3-year-old who's acting out, and you put them and their parent through PCIT, you strengthen their attachment to each other, and you give the parent tools to handle their behavior. So you end up with a kid that has way fewer trauma symptoms. That child may later need actual verbal trauma processing, but they may not, because again, that predictor of recovering from a traumatic experience in childhood is basically that parent-child attachment. Does anyone have questions at this point? Just want to send out a reminder to type in your questions to Chad as you get them, as you have them. Chad, have we gotten anything yet?
No questions yet, Joy.
Okay. We will keep moving. Oh. Okay. So we're going to go through sort of the PCIT process and how it works. I want to reiterate, I'm sure you're all very much aware of this, don't go try PCIT doing it yourself after just having this presentation. This is intended to be an introduction, maybe even whetting your appetite for PCIT. It's not considered a training, it's just strictly information-based to sort of let you know what it's like and let you think about whether you're interested in pursuing it further. But I am going to go into some of the details of sort of what we teach, but by no means all of them, because that would take too long. And I am at the end going to cover sort of what the full training process does look like. Okay, so PCIT, there are certain sort of core components. One is, and the big one, is that you have to have the parent and the child together. There are 2 sessions that have just the parent, and all the rest of the sessions have the parent and the kid together. It is very much we would call it a dyadic treatment. So it involves a dyad. Parent and a child, the dyad is 2 people. So the dyad in this case in PCIT is the parent and the child. Then the second really important key component of PCIT is that there is real-time coaching. While there are 2 sessions where we actually talk to the parent and say these are the skills we're going to be working on, we don't send them home expecting that they will just be able to do it. We're kind of talking about changing lifetime habits, things that a parent may have learned and not even been aware of learning when they were a kid as to how do you interact with kids. That's not easy to change. So PCIT focuses on real-time coaching where we actually coach the parent in the room with the kid. The therapist is actually not even in the room. The therapist is in some kind of observation room. The classic setup is behind a one-way mirror, and with the little Bluetooth earpiece is what we have these days. Just a little microphone bug in the ear that the parent can hear the therapist, but the child can't hear the therapist. And the therapist coaches the parent in real time while the parent is playing with the kid. And he's literally sometimes like telling the parent exactly what to say in a certain situation. Like, tell him he did a great job putting that green block on top of that red block. Sometimes we are that specific, not all the time, but a lot of the time we are, to help a parent in real time handle real situations. So parent and child together, real-time coaching. It happens in 2 phases. where the first phase is called child-directed interaction, and the point of the first phase is to strengthen the relationship between the parent and the child. That's the foundation for everything else that happens. And that is another core component of PCIT, is that there's both attachment strengthening, relationship strengthening, and also consistent discipline. But the relationship strengthening comes first. You can teach discipline without a strong relationship, but it's fairly miserable. It's not pleasant at all. When you have a strong relationship in the first place, kids are much more receptive to discipline. Then the final core component is the PCIT is, we call it mastery-based, as opposed to time-limited. What that means is that parents, to some extent the kid, but honestly it's more the parents, parents master certain skills, and that's what tells us, first it tells us, are we ready to move on to the second phase, the parent-directed interaction phase, and then second it tells us, are we ready to be done? The kid does have to be complying with commands and that kind of thing by the end, but it's based on parent skill mastery. Sometimes people will ask us, how long does PCIT take? And while we do have sort of average lengths that we can tell them, which we usually tell them 3 to 4 months, something like that, but the truth is that it varies widely for people based on how fast they do it, how often they come to session, how well they actually comply with the little homework assignments we give them, and just in general how fast they are to maybe change some habits that they've had. So it's hard to say how long PCIT lasts. It's not forever, but that sort of 12 to 16 weeks is what we usually tell people. But if we have to give a number, but it's actually fairly rare for someone to get done in that length of time, just because of things that come up and delay progress. And the key, but again, the key part of PCIT is that you're actually not just doing it for a certain period of time and then stopping. You're doing it until they're better. And that's part of why it has good good outcome research, because you're not done until you're better. Any questions at this point about what we've talked about so far?
Not right now, Joy.
Yes, I'm trying to move on. Okay. There we go. Okay. The sessions in PCIT, I feel like look different from sessions in a lot of other therapies. When I do therapy that isn't PCIT, it's usually in my office. I'm maybe talking to the kid and maybe talking to them about skills or helping them process emotions or something that happened, or problem solve something, or I might be talking to a parent and having that sort of thing. PCIT is different. There are those 2 sessions that I mentioned before where it's sort of a teaching session. You get one of those for each phase. CDI starts with a CDI teach, and PDI, that's parent-directed interaction, starts with a PDI teach. Those are the only ones that are just the therapist and the parent. They involve a lot of talking. The therapist goes through a ton of skills and has the parent actually practice them in the room a little bit, but there's a lot of talking. And then we do send them home, especially during the first phase. We send them home and say, go try this at home. Second phase, we actually don't let them try it at home until they've done it with us. But the first phase, we say, go on and do this and practice it this week and set up the time we're going to practice it every day. And then we kind of assume when they come back the next week, and I tell my parents this, we give you information, we tell you, we have you practice it, we give you a handout, and then I kind of assume that you've forgotten it all by next week, because it's really hard to remember all this stuff. And so what we do is, for coaching sessions, is basically every other session besides the teaching session is a coaching session. And what that looks like is you do a little bit of check-in at the beginning. That should be fairly short. Check in on sort of how the week went. Did they do their little homeworks? And kind of what behaviors did they see from their kid this week? Was it better, worse, the same as usual? Any other stressful things that are happening? But that's supposed to be like 5 minutes, 10 max, preferably not 10, preferably 5. Then you do what we call coding or observation for 5 minutes, where the therapist goes in the observation room and actually does a little bit of intro talk to the parent, and then lets the parent go and use the skills on their own for 5 minutes. The idea is to see what happens when the parent uses these skills without us interfering. And so the idea is, can they do this on their own yet? And that's how we figure out that mastery criteria that I talked about earlier to determine if we're ready to move on to the next phase or be done or whatever. The majority of each session, though, is real-time coaching. So after that 5 minutes, the therapist is on the little microphone telling the parent exactly what to do if necessary. Sometimes you can give the coach, the therapist, is talking almost continuously the whole time. You shouldn't be pausing for more than 9 seconds between each thing that you say, and either telling the parent exactly what to do or sort of praising them for what they've done that's right. The parent acts as a little bit of, besides a coach, also a bit of a cheerleader for whatever the therapist, for whatever the parent is doing that's good, and helping them through whatever they're doing that's not ideal. Outside of the session, the parent, I mentioned homeworks. This is actually really, the parent needs to come to session each week to kind of get that check-in and everything, but it's actually to some extent a bigger deal that they're actually practicing this outside of session, because that's when it's real. And what we do is we have them practice with their kid. We call it 5 minutes of special playtime every day. We want them to do 5 minutes of special time every single day with their kid and get it into the routine, just like brushing your teeth is part of your routine. Your special time with your kid. And what they're doing is they're practicing the skills at a much higher level of intensity than you would do normally. So it's not just playing with their kid for 5 minutes. It's playing with but it's playing with your kid while using the skills at a way higher level of frequency than you would actually be able to keep up the rest of the day. That's part of why we have them limited to 5 minutes. We don't want them to be overdoing it. So that is roughly how it goes. It gets there's a few more differences between sessions in the second phase as you're sort of expanding the discipline skills to more and more situations. But generally, that's how it goes. So having covered all that, I'm going to go into a few more details about what each phase contains. If you want to ask any questions about PCIT in general, basic format, anything like that, now would be a good time to do it. Otherwise, I will get going on the 2 different phases. Phase 1, call it CDI, child-directed interaction. You can also call it relationship strengthening. That's sort of the idea. You're sort of building up the positives. If you're familiar with the concept of an emotional bank account, we sometimes use this with parents if we feel like they're okay with that kind of symbolism, I guess. We will explain that kids need sort of deposits into their emotional bank account, and CDI is basically building up a nice fat balance in that emotional bank account. Basic rule of CDI is that the parent is going to follow the child's lead, and so part of why we have them do special playtime at home for only 5 minutes is because the parent can't follow the child's lead in a lot of situations. If you're talking about eating dinner, loading the dishwasher, crossing the street, the parent cannot follow the child's lead in those situations. The parent has to be in charge. So we set up a situation where it's okay for the child to be in charge. So it's a play situation. And the child can be in charge and make their own choices, which is very important training for life in general, because eventually that child has to make all their own choices. And so this is a way for the parent to set up a situation where it's safe and acceptable and even expected for the child to make their own choices, so that they can get practice in making good choices. Now, that doesn't mean they'll make all good choices, especially at first, but they get there. So in order to do that, in order to let the kid be in charge, the parent has to follow the child's, the parent has to avoid certain types of statements. So we call these sort of the don't skills. And what we want the parents to avoid is giving commands. So first of all, if you're following the kid's lead, you can't tell them what to do, because that's not following their lead, that's taking the lead. So the parent has to avoid commands, and that includes like really obvious commands like sit down or give me that. It also includes sort of subtle commands where you're trying to sneak it in there, like are you ready? Can you sit down now, please? Or hand me that, okay? Come over here, please. Sort of more indirect commands. We tell just avoid all of that. We're not going to give them instructions of any type during this time. Now, that doesn't mean that the kid is going to be perfect. We'll get to that later. Another thing that we need the parents to avoid in this time is asking questions. Now, this is a tough one. I tell parents every time that this is probably the hardest thing I'll ever ask you to do, and I'm not even kidding, because we are programmed to ask kids questions. We ask kids live in a world of questions only some of the time. I watched my own niece once before I had my own kid on vacation with probably like 6 adults. And that child got asked questions constantly. We give kids questions. We don't even need to be asking them, oh, are you using blue now? When clearly the kid is using blue. They're holding a blue crayon and they're coloring blue. You don't actually need to ask them. But we do it anyway. We're programmed to do it that way. And I think to some extent it can actually get fairly annoying for the kids. Many kids just shut down when they're getting questions. But even for the ones that don't, we're going to give parents sort of more powerful tools to actually get information out of their kid. One reason we ask kids questions is because we don't know what they're doing. They're building something and we have no idea what it is, and we want to know. And so we do give parents ways to actually help their kids converse and talk that are actually more sort of more conducive to more positive conversation. Kids can be very sassy when asked questions, and we're just trying to avoid that situation. Kind of the same as with commands, where if you give them a command, they've got the opportunity to disobey it. We're just taking that out of the equation for this special time. Same with questions. If you ask a kid a question, they've got the opportunity to refuse to answer or to answer rudely. We're just going to take that out of the equation. And so this is why another reason we have parents limit this to 5 minutes a day, because you can't live your whole life with your kid and not ever ask them questions. That's just not possible. So 5 minutes a day and then about an hour a week in session is they're going to avoid commands and questions, and they're also going to avoid criticizing, sort of negative talk towards their kids. I like to tell parents that criticizing kind of comes in 2 different forms. One is the kind of obvious ones that most people would agree this is a really bad idea to do to your kid, like, oh, that's ugly, or name calling, or things like that, that most people would say, well, yeah, you wouldn't do that. It's not that we don't, but we would still say, yeah, you wouldn't do that. But the other form of criticism that's a little more subtle is when we're telling kids what not to do. We're telling them to stop it, don't, quit it. All those things that a lot of kids, especially if they've got behavior problems, is kind of all they hear. So I actually have parents avoid all of that, which is not easy a lot of times, because many times the kids do actually need to stop what they're doing. We give them other ways to handle it, so don't worry, it's not like we're forgetting that it happens. But most of the time, when you're talking about a defiant kid, and a lot of the kids, the majority of kids in PCIT, they're there because they're defiant. If you tell them to stop doing something, I will ask you, what do they do if you tell a kid who's defiant to stop doing something? And since I can't hear you, I'll just have to answer the question myself, but they generally do more of it. I've actually watched kids do this repeatedly. One of my very earliest clients, I watched this little 2-year-old boy get up on a table, and his mom goes, "Don't jump off the table!" And he looks back at her and grins and jumps off the table. Because of course he does. That's what you do when you're a defiant child. Even if you're not that defiant, you'll do that. So we have them avoid all those don't, no, stop, quit, all those statements also. Okay, so instead of that, at this point, sometimes parents are sort of like, okay, so I'm not going to tell them what to do, and I'm not going to ask them what they're doing, and I'm not going to tell them to stop doing what they're doing. So are we just going to sit in silence? And I actually literally had a parent ask, are we just going to be quiet? I was like, no, actually, we're going to do the opposite of that. So we train parents to do is what we can call the do skills as opposed to the don't skills. And the basic summary of those skills is you're going to give positive attention to positive behavior. It doesn't have to be awesome behavior, it just has to be non-negative behavior. The kid is going to get more attention for that and way less attention for their negative behavior. And so we give parents very specific ways to do this. We call them the CDI skills, we call them the pride skills because the first letters spell the word pride. We call them the do skills, although I actually never call them that because it sounds weird. If you look at the first letters, it says praise, reflect, imitate, describe, and enjoy. I'm going to go through each of them. Most of the time, these are skills that almost everyone would say, yes, these are a great idea. And many people would say, oh, yes, I do that all the time. It's usually not true. For whatever reason, many of these don't come naturally. And maybe they just don't come naturally to people who are a bit stressed as parents, which might be all of us, to be fair. But parents, a lot of times we ask people in PCIT to do these at a way higher intensity level than average parenting and sort of normal parenting. And many kids who don't have clinical level behavior problems probably don't need it at the high level that we ask parents to do in PCIT. So the P in pride stands for praise. And we tell parents to do a very specific kind of praise. We call it a labeled praise. Praise has recently kind of gotten a bad rap occasionally. Like it'll be like, shouldn't praise your kids because it takes away their internal motivation or something weird like that, or it makes them feel like, I forget exactly what the other thing was. The thing about the type of praise we do is we have the parents praise the kids specifically for things the kid can control, and it's a thing that the kid can do again. You're sort of creating those, they used to call it sort of your internal tape recorder. The tape recorded messages that you have in your head. We don't even use tape recorders anymore. But the messages you have in your head that play over and over again that sort of tell you what kind of person you are and what the world is like. You're creating positive ones at this point. Many of these kids, they're either too young or they've to have one, or they've gotten bad ones. So we're reprogramming. So we tell the kids exactly what they're doing that's good. So whether it's sitting quietly, whether it's stacking the blocks nicely, or whether they're sharing, all kinds of things. We tell parents to use labeled praises as opposed to unlabeled praises, because unlabeled praises are not evil. They're just not specific. They just say, you know, oh, good job, or thank you, which is frequently fine for older kids, actually. But little kids, you need to say exactly what was good. They're usually doing 500 things a second, and you've got to be clear which of those things was the good one. So whether it was sharing or whatever else. We do encourage parents to, you know, great jobs. Very specific things are fine to praise, like great job putting the green block on top of the red block, but also like playing gently, or sharing, or balancing well, or staying calm, sort of big picture things that you want to see this kid do more often in lots of different situations. Praise is great because in general, kids increase their behavior. Whatever it was they're doing that you praised, they will do more of it. It helps them feel better about themselves. It helps them feel better about the parent. It helps the parent feel better about the kid. A lot of times parents come into PCIT and they can't see anything good about their kid, or very little. They are stressed by this kid. They see so many negative things from this kid, and we basically make them find good things because we say you have to find things to praise. So we basically make them find good things about their kid, and it works. They start feeling better about that kid. That's praises. Again, if anyone has questions, just send them in and Chad will ask me. Move on. The R in pride. So we did praise. Now we've got the R in pride. The R in pride is for reflect or reflections. And what this means is you're sort of like a mirror for the kids' words. You can say exactly what they said. You don't have to say exactly what they said. I've had parents who will tell me that they feel like they're being a parrot. There's nothing wrong with that. When a kid is 3, they do not need you to be original. They just need you to pay attention to them. As some kids are sensitive to sort of being copied, like or they say you're mocking me. In those cases, we have parents do more paraphrasing and also phrase it like you're, as opposed to copying the kid, you are agreeing with the kid. But this reflection is like reflective listening. It's good at all ages. You can use it later for talking to kids and spouses and everything else about like emotional topics and things like that. But at this age, you can just say exactly what they said. The kid can go on about how they're building a campsite and there's a dragon and they're guarding the campsite and all this stuff, and oh, a campsite, and that's reflection. It lets the kid lead the conversation. The parent doesn't even have to think about anything necessarily. It shows that the parent is actually listening to the conversation and actually makes the parent listen to what the kid is saying. It can help with speech. It can help with things like taking turns in conversations. It's actually a great conversational tactic. Great conversation skills. Kids will actually start reflecting their parents, which is really funny, because the kids will actually start doing the same thing. And again, it's a great conversation skill to have. So there's sort of an all-around positive interaction and positive conversation skill to start building up. So that is reflections. The I in pride stands for imitating. So again, you're in a play situation, and the parent, I usually tell people that reflections is for words, imitating is for behaviors, basically just doing the same thing as the kid. This keeps the kid in the lead of the conversation. When parents don't have a great idea of what to do, they don't really have to think of anything. They can just do whatever the kid is doing. That's actually better for a kid at this age. It keeps the play at the appropriate level for the kid, appropriate developmental level. If the kid shows it, you know they like it. And so you know they're capable of it, so you just join right in. It's great for social skills. If they're both coloring, they're sharing the crayons. That's great. So the kid is sharing the crayons, you can praise them for that. It can be the parent can help the kid with what they're doing. They can also just sort of do the same thing side by side with the kid as long as their main focus is still verbally on the kid. So it could be parallel imitation or cooperative imitation, just depends on the toy, really. So we've been through the P is for praise, the R is for reflect, the I is for imitate. The D in pride is for describe or descriptions. We've talked about what we want the parents to do is what we call behavior descriptions. And it's exactly what it says. You're describing the kid's behavior. You are like a sportscaster. So what we usually tell parents is that you're just saying exactly what they're doing. A sportscaster, the only difference is we have to make sure parents understand that you talk to the kid, not about the kid. So you don't actually talk about the kid in third person like a sportscaster actually does. But all you're doing is you watch their hands and just say exactly what you see. So you're stacking the blocks, you're lining up the people, and sometimes this sounds a little weird and awkward at first, but it actually is an amazing skill for helping parents pay attention to kids and it actually helps kids stay much better focused and calm about their behavior. Kids will actually stick with an activity longer if it's getting described as sort of play-by-play by their parent. It keeps the kid in charge of the play, definitely keeps the kid in the lead because you're not telling them what to do, you're just telling them what they are already doing. It's really cool actually to watch. Keeps the parent's interest on the activity and shows that the parent is interested. Of course, it shows approval. You don't want to, all of these skills, by the way, you don't want to do them about things that aren't okay. So if the kid, for example, in reflections, if the kid says it's about the parent, that's an ugly drawing, you poo-poo head, the parent does not say, oh, it is an ugly drawing. You don't do that. You reflect appropriate talk. You describe appropriate behavior. It's great for like teaching vocabulary, all kinds of concepts. It helps with speech. It's not like a speech therapy, but it is certainly very similar to some of the things that happen in speech therapy. Kids will actually frequently sort of not just stick with something longer, but they'll produce a better product. Not that that's your goal, but they will if they've got behavior descriptions. Like I said, it's really cool to watch. It's actually one of my favorite skills. The last part of prize, we've done praise, reflect, imitate, describe. The last is enjoy. Now, this doesn't actually mean that the parent has to enjoy like sending the panda down the ramp for the 37th time that day. What it is that the parent is showing that they like being with that kid. Sometimes with parents we have to actually coach on how to show that they enjoy being with their kid. Like look at him, look at his eyes, pat him on the back every time you praise him. Sometimes this comes naturally to parents, sometimes it doesn't. Sometimes parents need a little tweaking, or a particular kid needs a certain way to sort of show enjoyment, whether it's backing off or showing more. There's a big difference between the sort of like, oh yeah, you stacked the red block over there, and like, oh, you stacked the red block over there. It's just putting that enthusiasm in your voice, using gestures, using all that sort of nonverbal stuff that makes the interaction genuine. And again, sometimes the parents have to fake it, and that is okay, as long as they fake it genuinely. Okay. The goal for CDI is to meet what we call the 10, 10, and 10 criteria. And that is that coding, that observation that we do at the beginning of every session, where they've got 5 minutes to use the skills on their own. And what they have to do is 10 praises, 10 reflections, and 10 descriptions, and no commands, questions, or negative talk, criticism. Now, technically, they actually get up to 3 of those, but we don't really tell them that. And so, again, we call it the 10, 10, and 10 criteria. You'll notice that imitating and enjoying are not coded. They do need to be there, but you can't really count how many times they imitate or how many times they enjoy. So we don't have a number for them, but we don't move them on if those are clearly not there. At that point, you're ready to move on to the second phase. So if you guys have any questions about the first phase, go on and send them in. There we go. Okay, so the second phase is, you can call it the discipline phase, although honestly, CDI actually does involve discipline in that you are training your kid in certain behaviors. One thing that I didn't go over in a lot of detail was what to do when the kid is inappropriate, because we do have a contingency for that, and it's basically called active ignoring, which is very deliberately taking attention away from any negative attention-seeking behavior. And so you actually are already training the kid and sort of reprogramming the kid, so that is technically discipline. But PDI is where you deal with sort of the outright defiance, so when you need to have compliance right away. And it has two basic skills. One is, we call it effective commands. The other is consistent consequences, basically, consistent discipline. And the discipline of PCIT, what we use every time is a highly specialized form of timeout. Now, we do not tell parents that the discipline in PDI is timeout. PCIT is really pretty transparent treatment. We tell parents pretty much everything we're doing. We don't tell them about timeout because they will not come back. If you tell them that we're going to teach you timeout, they will say, timeout does not work for my child. I've tried timeout and it does not work, and they will not come back. The thing is that this is not the timeout they've tried before. The PCIT timeout has been very carefully developed over decades at this point to close all the loopholes that kids exploit and make timeout not work. If you're going to refer someone to PCIT, please don't tell them they're going to learn timeout. They won't come. There are so many ways to do timeout wrong that it's not even surprising that it hasn't worked for this particular family. And obviously it hasn't worked or they wouldn't be coming. We're going to talk about it briefly, but we will not get into all the details because it's actually quite detailed. The first skill, though, in PDI is we teach parents how to actually give commands effectively in the first place, kind of setting them up for success. The first thing is you only do it when it's necessary. We tell parents to use what we call direct commands. That means phrasing it in such a way that it's very clear exactly what's supposed to happen and exactly who's supposed to do it, which is the kid. So as opposed to like, let's clean up the toys, it's please clean up, Johnny, please clean up the toys. Positive actually doesn't mean say it nicely. Positive means, when you're talking about using a positive command, it means telling the kid what to do as opposed to what not to do. So, for example, instead of saying stop running, you tell the kid please stand still, or please walk beside me, or please sit down, or any number of things that you want them to do. You tell them exactly what to do as opposed to what not to do. Because if they just stopped doing something, for example, if you said stop running, they could skip or jump or crab walk or leap off the furniture or whatever, then all of that they would have technically stopped running, but they are still not doing what you want them to do. So it's actually another way of closing loopholes and also giving the kids a very clear thing that they should do. Sometimes they really need a suggestion of what they should do. We also train parents to give commands in a polite voice and in a calm voice as opposed to getting to that point where they're yelling at their kid. We frequently have them use the word please. It's not required, but it's not like a bad thing. We want the kids to use please if they want something, and so it's really good to have the parents model that. Also, another guideline for commands is that they're given for one thing at a time. So all of these are techniques for how to help a kid set up a kid for success when you're telling them what you want them to do. So you tell them only one thing at a time, because if you tell them like 3 things, or something that sounds like one thing but is really like 12, like clean your room for a 3-year-old, that's way too many commands in one. You keep it specific, so as opposed to act right, like please speak politely to your grandma. One of the a fairly important thing with commands is that it has to actually be appropriate for a kid's age. You can't give them a command for something they can't do. Usually this is fairly obvious. There are some times that are more subtle, and you have to, sometimes it's even on a case-by-case basis. For example, so at some ages you can include choices, but some ages that would actually overwhelm a kid, or some kids with attention issues or executive functioning issues or whatever. You don't want choices like go put on a shirt. That you actually need to hand them a shirt and say put on this shirt. But for some kids it's absolutely appropriate to have choices. Another thing about effective commands is that it's actually great to explain why the kid needs to do the command, but there's a time frame for this. You either explain it before you give the command, or you explain it after the kid has obeyed the command. Because if you give the command, and then the kid says why, and then you explain it, then they're stalling. And you're maybe even in an argument about why they should do it or should not do it. And before long, either you get an argument and they never even do it, or everyone's mad at each other and it ends up in a negative situation. So we actually have there's sort of this no man's land for explanations, which is that time period after you've given the command, but before the kid has done it, there's no explanations at that point. So if they're going to explain it, we have them explain it beforehand. Then we teach the parents actually what to do if a kid complies or does not comply. When you've given an effective command, it's actually very obvious whether the kid has complied or not. Ineffective commands, it might not be clear if the kid's doing it. So for example, if you say act right or stop running and they're crab walking, is that compliance or not? It's a little unclear, but if you've told them, if you've given an effective command, you can tell if that kid is doing it. So if they do, we train parents to use a labeled praise with tons of enthusiasm and just get back right into their CDI skills, get back into those pride skills, just praising whatever the kid's doing that's appropriate. Now, if they don't comply, that's when we go into this whole discipline procedure that I would like you not to mention to anyone you refer to PCIT. Because we first give them the timeout warning, which is basically if you don't do this, you'll have to go to timeout. And then you go into this whole timeout procedure, which I'm going to cover really briefly. But the idea is that it's used every single time a kid disobeys a command. So we have to teach parents only give a command if you care enough about it to put them in timeout if they don't do it. They have to do it every single time. We tell the parents, a lot of people have heard this sort of magic 1 minute per year of age. We actually don't worry about that. We just say 3 minutes for this whole age range. It works. 3 minutes is sufficient, and it's long enough for it to matter to the kid, and it's short enough that they don't just forget why they're there. However, timeout is actually mastery-based. It's actually not time limited. Now, it is time limited, and it has to be at least 3 minutes. But after that, what you're actually waiting on is for the kid to be quiet for 5 seconds. They do not have to be quiet the whole time they're in the chair. They would never get out. They do have to be quiet to get out. So what we wait for is 5 seconds of silence. At that point, what they basically learn is that when you're quiet, you get to get out. And so it actually teaches them self-regulation, which is a really good skill they need to have. So at that point, then, they have to comply with the original command. You can't just let them get out of following the command by going to timeout. So that's one way timeout fails in the real world, is that a kid can sort of substitute timeout for compliance. Like the parent cleans up whatever the mess was while the kid's in the timeout chair, and the kid never has to clean up. We don't let that happen. They have to leave the mess, and then the kid has to clean it up. And then we actually have the parents follow up with another command that's fairly similar so that they can then praise the kid for complying right away. The idea of that is that the kid learns that it's way better to comply quickly as opposed to going through the whole timeout thing. At this point, we do have a timeout backup procedure if the kid doesn't actually stay in the chair. But once the kid has mastered timeouts and the parents have mastered timeout, you start generalizing all of these skills to more and more situations. You start with very, very limited situations like playtime in the clinic, and then you let them do it at home, playtime at home, and then you let them do it in more situations, and eventually to where they can actually do a timeout in public and everything goes okay. So I'm going to go back to that slide really quick. Like I said, I covered that section really briefly because there's much too much of it to try to cover in a short presentation. But if anyone has any questions about the PCIT process, go on and ask them. I'm going to move on to referrals and training really quick if y'all don't have questions about that. Feel free to send in any more questions if you come up with them in a little bit. Okay, in the state of Arkansas, our highest concentration of PCIT therapists is in Pulaski County, and I think it's Craighead, wherever Jonesboro is. So Little Rock and Jonesboro is where we have the most PCIT therapists. The Child Study Center has probably the highest number, and I think there's one private practice, I believe Jason Ligori over at Arkansas Families First is doing PCIT also, so that's in Sherwood. And then besides Jonesboro, Mid-South Health Systems has several satellite clinics that also do PCIT. That list is probably current. Sometimes there's turnover in which county drops off, but they've got some reasonable coverage, pretty good coverage out in Northeast Arkansas. Other places we have PCIT therapists is There is one, I think just one, up at the what's called the Schmieding Developmental Center, which is a UAMS clinic up in Lowell or Springdale. And then Narissa Griffin is over in Fort Smith now. She used to be in the Schmieding Center. She trained someone there before she left, thankfully. That's Dr. Adams. Dr. Griffin, Narissa, is in Fort Smith now. She's in private practice. That's her practice, and she is, I believe, still doing PCIT there. And then over in Memphis, if you're in that general region, they're actually a training site. So they can also see people. I don't know if the Medicaid or insurance across state lines would be an issue, but that is an option. Now, if you're thinking about getting trained yourself in PCIT, you should know ahead of time that this is not a minor thing. This is not like a quick training. It does take a while. You want some commitment. You want commitment both from a therapist and from the agency. The therapist needs to have a master's degree or higher in their mental health field, be licensed or under the supervision of someone who is. If you happen to be a psychology doctoral student, you're also eligible. So the main thing to think about is, are you ready, and is your agency ready to commit to doing this? It is, there's a longish training process, like 40 hours of face-to-face. Now there is also a 10-hour online thing, and there's 30 hours of face-to-face training kind of option, but you still have to get a good bit of face-to-face training. There's different ways to do it depending on what kind of trainer you have access to. So like a workshop, so like a 40-hour total workshop, or like a mentorship sort of co-therapy model. Many of the people trained in Arkansas actually got their training through this sort of co-therapy, where they've got a trainer in their agency who can do co-therapy with them so learning PCIT that way. Usually start with a short didactic, short little presentation or something, and then basically you watch someone do PCIT, and then they watch you do PCIT through a certain number of cases. It can also be a combination of those. The main idea is that you get enough face-to-face training hours and you get enough observation or consultation or whatever. That is the workshop type situation. That's sort of the initial, that sort of gets you ready to start PCIT, and then the whole thing, the whole process, whether you're doing co-therapy or you use the workshop model, it takes about a year, maybe more. Depends on your referral base, honestly, because you have to complete to be certified in PCIT. This is a national or even international thing. You have to complete 2 cases with consultation, whether it's co-therapy or whether you're calling in once a week to consultation calls or something like that, or you have to get through 2 full cases, start to finish. So like very beginning intake to graduation. There has to be some kind of way for a trainer to review your skills, whether that's video review or in real time if they're with you on the case, like you're doing co-therapy and you're the lead therapist. There's different trainer levels. I mentioned at the very beginning that I'm now a level 2 trainer. Level 1 is a within agency trainer. They usually do co-therapy style training. Level 2 trainer is a regional trainer. We can do the workshop style training at agencies that are not our own agency, and then we follow that up with consultation calls. Master trainers are like the super cool kid club. They can train the trainers. Our master trainers that did most of our training, they're out in Oklahoma. Here in Arkansas, your level 2 trainers, me and Ben Siegel are at UAMS. Now over in Memphis, Kristen Hoffman is a level 2 trainer. She's at the University of Tennessee Health Sciences Center in Memphis. Other level one trainers, this doesn't necessarily help you unless they're in your own agency, but I listed them there. Our closest master trainers are the ones in Oklahoma City that trained us, and then of course visit the PCIT website to look at trainers. I don't know if it's completely updated, but it certainly has the master trainers accurate, and I believe it has level 2 trainers accurate also. Okay. That's all of my talk, so if you have questions, send them in, and Chad's going to do one more housekeeping thing, I believe.
Yeah, thanks, Joy. And I think you, some folks that did write some questions, and I believe you addressed them. One person did write in, so what's kind of the first step for an agency to start PCIT training?
Yeah, that is a good one because, like I said, it's sort of an agency level commitment and an individual therapist level commitment. So like an agency, honestly, I would probably say email me as the first step. We have sort of a packet of agency readiness checklist material that can kind of guide an agency in deciding, is this a good thing for them to invest in? And you know, what's maybe the time frame that it would take them to sort of get stuff in place? Because there is some sort of infrastructure stuff, things that you need to do to get ready to do it. You also need to have preferably at least 2 therapists who can see clients in the right age range. So if you're an agency, if you're a director or something, Chad I think was going to send out the readiness packet anyway to anyone who wants it, or to everyone. So there's that. Check on your sort of agency readiness. If you're a therapist, or is that a question also, Chad?
Yeah, so yes.
If you're a therapist, like you're not a director, but you're a therapist, probably the first thing to do is check with your director to see if it seems feasible. Email me, or you can email Chad and he'll give you my email or send you to me. And in a lot of cases, agencies have been able to do PCIT successfully because there's sort of demand for it. So figure out, okay, does your caseload support this? Do you need to be able to treat kids who are little and have disruptive behaviors? Is that a thing that you need? If it's not, then PCIT is probably not for you if you don't even have that in your caseload. But if it is, and you want to be able to do this, then just start advocating, sort of start making noise, saying, we need this, we need to be able to do this. PCIT is kind of, certainly, it's hard to say what is the best treatment out there, but it is certainly up there and sort of like the best treatments we've got available for these kids in this age range with these problems. Once you have training PCIT, yep.
Oh, I was just going to say, just in the interest of time, I have advanced to our CU slide, so if that's something you're interested in receiving, just please send me an email, and I will get you your CU. And Joy, I just want to ask you, another individual asked a really great question that I want to be able to answer for the group, but what would be your advice for folks who are in individual private practice? How would they get started?
Oh, well, that's a good point.
Or does that look different in any way?
The main difference is that you're going to have to be able to maintain it yourself. You get to make the decisions if it's your own individual private practice. At least in general, I think you can. So it's kind of figuring out, is this something you're ready for? Many agencies that have multiple people, we'd like to have at least 2 PCIT therapists, but obviously that's different if you're kind of practicing on your own anyway. So yeah, if you're in private practice, if you think it's, again, email me. There are considerations like kids are noisy. PCIT sessions are frequently noisy. There's lots of yelling sometimes, not all the sessions. Sometimes it's not even, sometimes it's happy yelling. Sometimes there's very angry yelling from the kids. And that you have to think about, is that something that's okay in my clinic? Is it something okay with other clients? Is that going to scare people? Probably not. Usually that's fine. But you think about it in terms of, can I do this? And again, the agency checklists would still be applicable, so we can send those to you if you want to sort of go through the requirements. It's a financial investment. There is sort of a monetary requirement to kind of get into it. The places who have done it, not just here in Arkansas, but also throughout the country, have said that it really has a great payoff and payback once you've got it in place. It is a bit of an investment up front, so that's sort of what you should consider is, am I ready for this? Is this something I want to do? It does seem to work to work really well from an agency perspective once it's in place and you've got good infrastructure and all your logistics set up.
Okay. Well, thanks, Joy. And we've actually had a flurry of other questions, so I will forward those on to you. They're really great. We're just I want to be respectful of people's time. So if you did answer or write in a question, we will follow up with you after the webinar. So thank you, everyone, for joining us on your lunch break. Again, if you want to earn a CU, just be sure to send me the code there, email it to me, and we'll get that for you. Thank you, Joy, for a great presentation.
Thanks, Chad.
All right. Take care, everybody.
Chad, do I log out? What do I do?